Now we'll move to our last speaker. I'm very pleased to welcome Dr. Laura Murray and her team. Dr. Murray is a senior scientist and a clinical psychologist in the Johns Hopkins School of Public Health and the Departments of Mental Health and International Health. She has extensive expertise teaching and implementing evidence-based treatments for mental and behavioral problems. She has conducted a range of global mental and behavioral research in countries such as Zambia, the DRC, Ethiopia, Myanmar, Ukraine, Iraq, Cambodia, Guinea, among others. Dr. Murray is the developer of a Common Elements Treatment Approach, CETA, and she's the founder of CETA Global, which has a mission to provide evidence-based, scalable behavioral health solutions. Dr. Murphy publishes extensively in top journals. She trains globally. She speaks regularly at conferences and organizations and consults with organizations to improve functioning through skills training on stress, resiliency, and leadership. So welcome, and thank you for joining us.
Thank you so much, Dr. Reynolds. So as you mentioned, I have brought a team today. So it's certainly not only me, although Stephanie and I run the global work in mental and behavioral health at Johns Hopkins. And we are joined by three fabulous colleagues, Kira, Oksana, and Nina, who you will hear from, who have worked with us for a while in Ukraine. So really excited to see many participants from Ukraine. I hope that you put your questions in the chat and certainly follow up with these ladies after. So we wanted to start on a very practical level and just throw out many different common signs of distress that we're seeing with COVID. And these run the range of just not sleeping well, as Tracy just mentioned, not eating well, just not taking care of yourself, being on a different schedule, all the way up to pretty significant depression, anxiety. Someone in the chat mentioned panic. These are all common signs that we're seeing from COVID. And so we wanted to shift into what do we do when we have these problems and challenges? And as Dr. Reynolds mentioned, we have a system of care called CETA that we have integrated in Ukraine as well as many other countries. But today we'll be focused on our Ukraine work. And what's really exciting about this system is it goes all the way from assessment, which is very helpful just to be aware of your levels of distress. That's usually the first thing we encourage. And then through triage of some people just need some skills, some more routine, some practical solutions, while others really could use someone to speak to. And my colleagues will talk a little bit more about those programs. And so within this CETA system of care, I'm just going to make a couple very quick points. One is our folks that are trained in CETA can treat many different problems. So you see the list here of whether it's violence or anxiety or depression or aggression. We use these puzzle pieces you see here. We put them together in different ways to treat each individual in front of us in a very holistic way. The other really neat thing about this CETA system of care is that it spans all levels of severity. So as I just mentioned with COVID, sometimes it's just really assessing and being aware of where you're at day to day, depending on where the pandemic is 2 years ago versus now when there's an outbreak. All the way up to, just learning different skills and more tailored to the client. And then all the way up to, if you're really having quite significant challenges. So with that, I'm going to turn it over to Kira, my first colleague.
Hi, thanks, Laura. It's so nice to see you all here. And I'm going to start by telling you more about CETA's short session on thinking in a different way. The session has multiple purposes, like providing basic information on stress, assessment to raise self-awareness or track reactions to stress, teaching you skills that helps to handle everyday stress, identifying and triage those in need of mental health services. We started with this intervention in 2019 in Ukraine with the intention of running CSS in live group format. But then in 2020, when the pandemic started, we pivoted to an all tech-based intervention. And we currently just finished a trial of TCSS here in Ukraine. We have been running CETA in Ukraine for years, but really, like before CSS, we struggled for years about really like how to engage people to treatment, because there is a lot of stigma around that in Ukraine. And that is why we decided to develop CSS. This is when we thought it might be useful to add it into preventative program that could reduce stigma, give clients an idea of the types of things they can learn in CETA. And it's been interesting to lead this and see challenges and lessons learned. Like many people think that technology is a good thing and we like technology, but it is challenging. Like many providers who came to the program and were trained in providing CSS, yeah, some of them, they knew technology very well, but some of them not at all. And we provided a lot of support to them to learn that. And the same is actually for participants. The good thing about CSS is that it is online and it is accessible for people in rural areas. And we know that people from rural areas has less access to care. But at the same time, those people are struggling with technology. And that was the point for us and challenge for us, how to support them and help them to participate in Zoom. But we managed that, and that was successful. And at the end, people were grateful to learn the skill and to have a tool to assess their reactions to stress. Now, I also can say that we trained lay providers, and they were very excited at the end of our training, saying that they are happy to have a tool to help their community members from their people who are close to them. Just to mention a bit about the implementation, it's very flexible and we can provide the training in person or through the Zoom. It can be in a group, like from 6 to 10 people, or it can be provided individually. The key is ensuring that you do have a high level service for referral available, because we really have, we did have a big amount of people who were where we identified high risks of safety. We like people who wanted to kill themselves, or people or men who were very aggressive towards others. And we managed to refer them to the higher level of mental health services. And now I'm going to pass it over to my colleague Oksana, who will explain more about CETA, which is our primary option for referral for TSS in Ukraine.
Thank you very much, Kira. I know Kira, Stefan, and Laura for years. Since that time, we didn't have a lot of little kids around and knew how to have fun. And at that time, I was volunteer at the hospital with veterans, with wounded veterans. And although I had a psychological education, I still felt the lack of practical skills. And then I met these amazing people who introduced the absolutely new way of the training that was very informal. They were running around giving us chocolates for the right answers. And that was the first time I got my chocolate for being a bookworm, which I'm proud of. And they introduced CETA to us, the approach with which we could handle many mental health problems, such as anxiety, substance use, depression, and trauma, and suicidal ideation, and interpersonal violence, and homicidal ideation, and even if a person has combination of those. And I was very surprised when I start seeing my first clients and I saw how rapidly they got better. They feel much better. And from that time, they won my heart. And I was one of those 147 SIDA counselors in Ukraine, and one of those 31 supervisors in Ukraine, and one of those 4 local trainers right now. And when the pandemic started, we had to change our services to do that online and via phone. And in Ukraine, we do not have a lot of services, mental health services via phone. And especially that was very important for those people from rural areas and from those who are have a very low income and doesn't have smartphones, and we cannot, and no netbooks, so we cannot see them. And not only that was interesting, but also that we had an opportunity to develop the new digital training. That was exciting and thrilling at the same time. And I am one of the voices of those characters. Never thought that I have an actress talent. Now thinking about new career. But that was amazing to be on the backstage, to see how this app is developing and how then it will work together. But more amazing, it was to see how our newly trained counselors are learning so much from just the tablets. They are learning all the information. They answering the quizzes. They are very engaged. And that was we as the trainers were very astonished, because we were just sitting beside them and dreaming about the career of actress, and they were learning at the same time. And the new group of SIDA providers in Ukraine, 25 participants, we train via technology, and that was an amazing experience. And now I want to pass the word to Nina, and she will tell a little bit more about the challenges.
Hello, everyone. It's nice to see you and to hear you. And in addition to delivering SITA and teaching it via tech, here is what we've seen in terms of mental health and behavioral problems in Ukraine in the context of the COVID. These are panic attacks, anxiety with rising tensions, family violence, and this is similar to other sites and countries where we work. So hearing such great things and results from SITA, there was so much interest in other countries on implementing SITA that there were other trainings planned, and the region that I got to go was Kazakhstan. So keep in mind that it was in the middle of pandemic. It was really a question if we could go or we could not go. And as soon as we got vaccinated and the epidemiologic situation in Kazakhstan improved a little, we went there. That was a really interesting experience for me as a SITA trainer, as it was our first Russian language training. And obviously we were wearing the masks throughout the whole training, throughout the all 10 days, interacting with participants. It was also a different group. These are actually providers that treat individuals in the TB clinics that have a variety of mental health problems, mostly depression and drinking alcohol. That's it about sharing my great experience on another country where we also implement SITA. And I'm passing to Laura.
Great. Thank you so much, all of you. And I think we just wanted to speak to the ability to work in different countries and different contexts and give you a real live example of how we have rolled the system of care out in Ukraine, from prevention and skill building all the way into full SITA treatment. Related to COVID, we also are doing a lot with healthcare workers and those that are helping on the COVID front lines. And we're seeing some of those same symptoms that were mentioned, of anxiety and depression and just burnout and things like that. So really exciting options for helping to heal those not only with COVID, but those helping fight this pandemic. Thank you so much for all your time, and please reach out if you have further questions.
Thank you so much to all of you for sharing these very interesting program, and it sounds very flexible, that it's not just sort of targeting one, but sort of the whole compilation of different mental health problems that may occur. And I'm assuming that is this toolbox available to say our participants who might be interested in learning more about it?
Yes, if you go to the website of CETA Global, you'll see a number of different informational sheets about it, and information about how to get training and where we're already doing this, and all sorts of things. And then also feel free to reach out if you need additional or different information.
Oh, thank you. And one question I saw that was interesting in the chat box, and again, there are several questions, and I don't know we'll be able to address all of them, but one was sort of, we've been talking about all these potential mental health problems that go along with COVID. And one participant asked, can they just ride it out, or do they necessarily need to seek treatment if they're experiencing some of these COVID-related mental health problems?
I think that's a great question. And I think the answer, unfortunately, is it depends on the level of severity and how much it's affecting your functioning. And that's why one of the things we really talk a lot about is just making sure people can easily assess themselves day to day. Because as the pandemic has gone through its shifts that Dr. Everly has talked about with all disasters and pandemics, our human reactions tend to vary. So it's not a one-off decision. And we really look individually about, is it affecting your livelihood, your relationships, your ability to sleep and eat, things like that, in which case you would want to get help. We also caution, though, that during a pandemic, it is very normal. These reactions are normal. Many people feel unsettled, and we don't want to pathologize that either. But certainly that might be where some skill building can help.
Dr. Murray, we have also another question from the audience is, how do we fight disinformation or mental health about COVID with technology? So there's been a lot of, spread of misinformation. So how can the use of technology help?
No, that's a great question. I'm not sure I'm the most knowledgeable to comment on that. I think media has a lot to do with that. Just speaking from what I do have expertise in from a psychological standpoint, because I also saw a question in there about sort of finding common ground when someone has different thoughts about vaccination. From a psychological standpoint, it's really important just to ask people where they're coming from, rather than shooting out the correct information if you have it, but really sitting back and trying to listen, where did they get this misinformation, and tell me about that, and tell me a little bit about why you believe that, so that you can understand and frame your approach. And that tends to work a lot better than just, sort of arguing or spitting out what might be even the correct information. And, like Tracy had mentioned, it's about giving each other some grace and some latitude. People are going through different situations with families and kids, and just how they react to something like this. So also just being a little bit more patient with each other.
Thank you.
Any last questions?
And if I may, I've noticed several questions on the similar topic. And the topic is, what are your top 3 suggestions for post-COVID life? So what can we say to our participants?
Yeah, I think any of the panelists can jump in here, but.
Olga, did you say for post-COVID symptoms, or?
The question, which seemed to summarize several questions, sounded, what are your 3 top suggestions for post-COVID life? So I assume people who have been sick with COVID. So what would be your 3 top suggestions for going over this? And yes.
I can start, and folks can chime in. I think first and foremost, I'm going to borrow this idea from Tracy, be kind to yourself. I mean, I think it starts there. I think be tolerant of others, but also realize that they are a tremendous source of strength and support. As I said, the single best predictor of human resilience is our connection, our ability to be compassionate and supportive of one another. We're all in this together. And I think the final thing that I've learned, not just from this disaster, but it's certainly been underscored, is that that life is a journey, not a destination. And I hate to say that, it sounds so trite. I've heard it my whole life. I'm embarrassed to say I didn't understand what it meant until I was about 40 years of age. Most of us are destination oriented. That's what we were taught to do. Drive for this destination, the next destination, the next destination. The problem is that sets us up for failure. If the destination is, let's get this COVID over with in 6 months, and it doesn't happen, what does that mean? If, okay, now the second wave, now that should be over in 3 months. And if that doesn't happen, what does that mean? We need to shift the paradigm. To borrow an overused phrase, but I'll use it anyway. This is a marathon, not a sprint. The people that make those adjustments and understand that we will hit milestones. We used to call them destinations. We'll now call them milestones. Sometimes they cause us to advance in one direction. Sometimes they cause us to advance in another direction, an unanticipated direction. But we are advancing nonetheless. And I think it's keep a vision, keep moving. And in the end, everything will be okay. And if it's not okay, it's not the end.
I think that's actually a very wonderful note to end this hour on. We are at the top of the hour, and I just want to give my deep appreciation to all of you for sharing your wonderful expertise. And I think you've provided a lot of terrific resources that are available to participants today, and I think they can reach out and explore those further. And Dr. Vera, do you have any last comments before we adjourn?
I would also like to express deep gratitude to all the experts. And I have learned a lot. And I'm sure that all our participants also have learned a lot. And it will help everyone. So thank you.
Thank you. And be well, everyone.